If your therapist is always talking about themselves, please leave therapy with this person. Perhaps they have quite high traits of narcissism. So when is it okay to self-disclose as a therapist, and when is it not such a good idea to self-disclose? And is it okay at all? Like, are we allowed to talk about ourselves? Are we allowed to answer questions about ourselves? Of course, our clients are curious about us. Therapists are quite mysterious people because we tend to not talk about ourselves, and therefore it's quite understandable that a client would be curious about their therapist and might want to ask a question. And of course, we've been trained in how to handle this. Of course, some therapists handle it better than others, and some completely cross the line and find far too much enjoyment in talking about themselves in someone's session. So let me tell you about the rules on this and kind of what's ethical, and then what's, of course, like many things, in terms of the way that therapists practice, a lot of things are not black and white. But as a psychologist who is 12 years postdoctoral training, so it's been 12 years since I completed my doctorate, I've had lots of experience. I will tell you how I deal with self-disclosure in therapy. I definitely deal with it a bit differently than ever before, particularly because of actually social media and being a bit more open about struggles that I've had and stuff like that. And I'm progressively more and more open about issues that I've had in my life and struggles, and I like to share that information just to normalize it and help end the stigma in relation to mental health issues. But then that can obviously leave the door open to being asked lots of questions by my clients, and that then my clients might want to find out more about my struggles quite naturally. They're going to be, if they see that I posted something on social media about an issue I've had or something I've struggled, of course they might be curious about how I handled it or how I ever overcome it, or about my story, because they might really want to know and want to know how I did it, so they can kind of apply the same thing. But therapists need to be really careful about how much time in a client's session they end up speaking about themselves. So let me tell you about how I do it, and then let me tell you about how we're trained, first of all, and then I'll tell you about how I handle this type of thing. So we're trained in quite a black and white way because it's easy for people to then know what to do, and in the session just know exactly what to do and stick to the rules and not end up crossing any boundaries that they shouldn't. So we're trained to not self-disclose at all, which is great training. It's very helpful. So then when clients ask us questions, we are prepared with our diversion strategies as to not answering the questions. So it's kind of funny, because when you learn a skill and you learn how to handle something, it's funny to think back as to the times when it was really awkward and how you dealt with it in a really awkward way. So for example, when I was training, when I was on my doctorate program, clients would say to me, "Oh, how old are you?" Or "Where are you from?" Or "Are you going on holiday?" Or if I was taking 2 weeks off, "Where are you going on holidays?" And I would awkwardly say things like, "Oh, well, what does it mean to you to know where I am going on holidays?" Or it seems very important to you what age I am. I'm wondering why that might be so important to you. Of course, these days, if someone asks me a question that I don't think would be a good use of time to answer, or I don't feel comfortable answering, I would just say to them, I'm a bit worried that I would end up, if I start answering this question, I would spend way too much of your session talking about myself. And, I'd really enjoy that because I don't mind talking about myself, but, this is your session. You're paying money to be here, and I really want to focus on this session and make your issues the absolute priority. That's the top of our agenda here. So for that reason, let's just kind of, stay focused on what you would like to get out of this session. Or I might just be really honest and say, I'm actually not comfortable answering that question. And, and I'm sorry, I'm not giving you that information, particularly because it seems like it's something that you're curious about. But is that okay for you if I don't answer it? So, I think just being as honest as possible really helps. Often I'll just answer the question if it's not going to take up any time. I'm actually as therapists go, I'm quite an open therapist because I think that, and this is just my personal style as a therapist, I think that the best way to build rapport with my clients personally is to not be a blank slate and to be more open. And if someone asks me a question that's just like going to be a one-word answer, I'm most likely to just give them the information and then we can move on with their session, focusing on what they want help with. To be this kind of awkward, I'm not going to tell you anything about myself ever type of therapist, it's just not my style. But at the same time, I do think that what generally, from my experience, what generally happens is that clients really respect the therapist, and my experience is that they just don't ask me any personal questions almost all of the time because they already know how it works. Like clients just get from day one how it works in therapy, and they tend to just know that it's rude to like interrogate your therapist, or like it's rude to, it's a boundary issue to ask personal questions. So I'm very lucky to have clients who just kind of get that right away, but that might not be every client. Some clients, they don't get the boundaries of therapy and what goes on, what tends to happen in the typical therapeutic relationship. Because the typical therapeutic relationship is you don't ask your therapist personal questions. You ask them questions to do with your own treatment and your own condition and stuff to do with, helping you. But clients are full of surprises and people can catch you off guard. And I think one of the most common things that therapists worry about is if they're open, will they come across bad? Like, will the client judge them? Are they going to come across as like a bad therapist? There can be a lot of worry from the therapist about the self-disclosure. And also, I think it's absolutely fine if you are worried about the self-disclosure, if you think that it might cause issues in the therapeutic relationship because you're giving too much information away, then just don't do it. It actually works much better when your clients don't have very much information about you because they respect you more. Like, this is why you can't give your friends therapy or you can't give your family members therapy. They know your flaws. They know you're not a perfect human being. They know that your advice might not be the best advice in the world. So the respect that you get, and this is such a privilege, being in the position of a therapist, your clients give you loads of respect because they see you as a professional and they don't know that much about you. It's kind of like the same as other professions, like if you go to see your accountant and they're like a fully qualified trained accountant, you are going to respect they're going to give you the best financial advice. If that person happens to be also your dad and they placed a really stupid bet on something and lost some money through gambling, it might be just a silly thing, a small amount of money, but it's your dad, so you don't really take them that seriously. And when they try and give you financial advice, you start joking about the time they lost the money on the stupid bet they placed. So having extra information about people means that you do not respect them in a professional light as much. So therefore, therapists should not give too much information away about themselves. Stay mysterious. You can be an open book with all your friends, but with your clients, just kind of know that it's not going to be helpful for them to know absolutely everything about your life. And that's one reason, but there are some other reasons. In relation to self-disclosure takes time. And when a client comes to see me, this is their time. 50 minutes flies by. It goes by really quickly. And that 50 minutes is for them. That's what they are paying for. They are paying for me to focus on them in that time. So if they ask me a question, I'm quite a storyteller. So if they ask me a question, I know that's going to take up time. And even if I try to give the answer really quickly, it's still their time. And then also, how much is it going to benefit them? If it's going to benefit them to the extent that they're it really helps them get over or work through what they're experiencing, then yes, I do want to share the information, even if it's a little bit, a little bit uncomfortable for me. I'd prefer to share the information if I think it's going to significantly help them. But if I think this is not gonna, like where I'm going on holidays for 2 weeks, yes, I can say the country. I don't care that if, I don't care if my clients know where I'm on holidays. Some therapists really want to be private, and that's I respect that. That's up to them, and I understand why people want to be private. But for me, I don't care. If my client asks me where I'm going on holidays, I'm telling them where I'm going on holidays, and then that ends there, because no more information about me going on holidays is ever gonna help my client. So I have to be really careful about how much time it's going to take up, and I have to be, if I'm going to be more elaborate, I have to be really careful about how beneficial that's going to be for my client. Now we've got enter the world of social media. When I started working as a therapist, believe it or not, no social media actually existed apart from Bebo, which a lot of people watching this will have no idea what Bebo is. I had already started seeing clients when Facebook came out. That is giving away my age. So anyway, there was no social media, and when social media came out, as a therapist, you couldn't share anything on social media. Like, that would be completely irresponsible. You just wouldn't do that. You had to have all your accounts private, and that was just the obvious thing to do. If you had your account open as a psychologist, you would probably be fired. It was not okay to do that. It was a massive career mistake if you did that. That's not obviously how things work anymore. There is a lot of psychologists on Instagram. The whole sharing of your lifestyle has now become an acceptable thing in therapy. It's really interesting how times have changed over the course of my career. And I have chosen to share a lot more about my own psychological struggles, because believe me, I've had quite a fair share of them over my time. But luckily, I've really suffered, and I've really overcome a lot of different things. And I find that it's the overcoming part is the really interesting part of the story, because I think that gives people a lot of hope. So if my past suffering can ever help someone have hope that they can also overcome a difficulty, then I really do want to share that with people where I feel comfortable to do so. And actually, I don't always feel so comfortable to do so, but I also feel that I have a purpose to help people, and I have a purpose to help people in relation to their mental health. So I don't really mind. I just kind of suck it up sometimes and share some things that I in the past would have been more private about. But if I share that on social media and my client comes in and wants to spend a lot of time talking about that, I don't want to spend time talking about what I've been through in their session. But what I will say is, I suffered that. I got over it. But this is your time here, and I'm very conscious about spending too much of this time talking about my story. The information's out there. You can look it up. You can watch any of the content I make if you want to find out more about my story, my journey, my struggles, what I've been through, and maybe it will help you. Who knows? But this is your session, and you're paying for my time right now. So I want to spend all of this time talking about you. And so that's how I deal with the art of self-disclosure on social media, but actually very minimal self-disclosure in the therapy session. So clients will never come to see me and hear very much about me. That's just not how, that would be awful. In fact, I think it's completely unethical to spend time in that way. I once had a therapist who loved talking about herself. She was quite high on narcissism. It was a long time ago, and I allowed it to happen because she was the expert. She was taking the lead. You give people a lot of control in these. The therapist has the power in the session in relation to guiding the session and leading it, and it takes a brave client to say, hang on, I've noticed, can I give you some feedback? I've noticed in our last 3 sessions you've spent this amount of time talking about yourself. I feel that that just seems a bit much in relation to what I would expect from a therapy session. I thought that we were here to kind of focus on on my problems. Now I know that therapist truly believed that talking about herself was helping me, And some of her stories were kind of interesting, and, you know, maybe it sort of helped me kind of build a little bit of rapport. But I know now, looking back on it, that she was just incredibly high on narcissism, narcissistic traits, and that she just really enjoyed having an audience and really enjoyed talking about herself. And I would have actually benefited from a therapist who was a lot more focused on actually trying to help me and focus on my difficulties. So if you find that your therapist is talking too much about themselves in the sessions, I think a good way of handling it would be to say to your therapist, would you mind if I offer some feedback? Now, this can be really anxiety provoking, but I think when we do difficult things in life, we grow and we develop. So feel the fear and do it anyway. If this does make you really feel very anxious, just ride through that anxiety and still try to say, you know, do you mind if I give some feedback? I've noticed that you've been talking about yourself a lot in these sessions. Your self-disclosure, while I appreciate it, the stories seem to take up a lot of time, and I know that therapists are actually trained not to self-disclose, so I'm curious about your reason kind of for doing that, and just see what your therapist has to say. A really good therapist, an empathic therapist, is going to say, I'm so sorry, I feel so bad that I took up that time and I missed the mark, I misjudged it. You know, I'm going to be so aware of that now. Thank you so much for giving me the feedback. I got a bit carried away with the time in relation to telling that story. So someone who owns up to it and apologizes and, you know, honors and respects your feelings about that type of situation, that's a sign of a highly empathic therapist. So watch out for this. And to summarize, you know, should your therapist talk about themselves in therapy? No, they should not talk about themselves in therapy. Are they allowed to answer questions about themselves if you decide to ask them? Yes, they can, but they have to be very aware of how much time that's going to take up, and they have to guide you so that that doesn't end up taking too much time, even if you're the one who's asked the question. And they really have to calculate how much is their self-disclosure going to help you. I hope you've enjoyed this video. If you're enjoying my content overall, please press the bell icon when you subscribe to my channel, and then you can be notified about more videos that I make. If you want to ask questions, leave some comments in the box below, and I try to reply to a lot of the comments and questions. I may not be able to reply to all of them, but if I don't reply, just ask the question again, I'll probably see it. And if you want me to make any particular videos, just let me know and I will try to cover some of the topics that you're interested in.